Tobacco remains the #1 preventable cause of death in the state of Oregon. Tobacco kills 7,000 Oregonians each year, which is roughly the population of Walla County. An addiction to tobacco starts during childhood. 90% of current adult smokers started smoking before they turned 18. Practically every person I know, including myself, has a story of a family member or a very close friend who's been touched by this scourge of diseases caused by tobacco use.
Thanks everybody for coming to celebrate the success of Measure 44 in curbing tobacco use. As a physician, there's perhaps no more valuable endeavor to protect my patients' health than helping them stop consuming tobacco and keeping others, new tobacco users, from starting. Doing something sensible like raising the tobacco purchase age could reduce teen smoking rates by as much as 25% in the state. Every disease has its cure, and efforts like this are the treatment. But tobacco and tobacco-related illnesses aren't cured yet, and I'm asking everyone's help here and throughout the state and Central Oregon to help encourage our representatives in Salem to pass Tobacco 21 legislation through the House this session.
You know, public health understands that by convening partners, that's how we get the work done. We do that in many areas in public health, not just tobacco work, and we understand that part of that is collaborating with our coordinated care organization. The conversations between public health and the CCO, Coordinated Care Organization, really focused on what are opportunities that we can look at health outcomes and really work together, and tobacco is really one of those opportunities to improve health.
PacificSource's CCO has partnered with our county health departments in Central Oregon to help our members quit tobacco in a variety of ways. Muriel mentioned the Regional Health Improvement Plan that has some specific indicators and health outcomes that we're working towards in the next few years. We also have helped collaborate and funded with the OHA the Tobacco Quit Line Interface project that kicked off earlier this month, which will leverage our health information technology resources to enable a closed-loop referral system to occur throughout our region and send directly to and from the state's tobacco quit line. We expect that this will increase the rate of referrals significantly and, of course, therefore help to improve our cessation rates regionally. We also worked with our county health departments and the OHA to wrap our regional transit bus system, and so that was already mentioned earlier. These types of health communication campaigns are a core strength of our public health in this region and the kind of support that health systems can really use to improve our health outcomes.
This region, which includes Crook, Deschutes, and Jefferson Counties, as well as the Confederate Tribes of the Warm Springs, is an example both of innovation and leadership. It's forging pathways from the clinic and the hospital to the community for improved health.
In 2016, the Central Oregon Health Council implemented its first joint project to improve tobacco-related health outcomes. And this was really a community-based strategy to really look at how can we make a difference. And by leveraging financial support with State Public Health Division, with the Central Oregon Health Council, the 3 health departments were very engaged in this process and helped move it along. Also, we engaged with the Central Oregon Intergovernmental Council, where we're sitting today, and really looked at implementing a mass media health education campaign to support current tobacco users to use the quit line. And I think that is really important, that we really look at a number of strategies to affect public health and work on the tobacco issue. So this collaboration really succeeded from the collective strength and expertise of the coordinated care, public health, state health division. I think we really look at how many partners do we bring to the table to really create these kind of strategies.
Oregon passed Measure 44, which increased the price of tobacco. And that's kind of what we're celebrating today, the celebration of this 20 years ago. It solidified Oregon's commitment to health and dedicated a portion of the revenue to activities that work to prevent youth from starting to smoke and to help people who are smoking to quit. In 2017, this year, the 20th anniversary, tobacco prevention and education activities have reached every county and have reached every tribal nation in Oregon, thanks to the collaboration of individual communities coming together to set that goal. Nearly 2 out of 3 Oregonians who do smoke currently want to quit. And because of Measure 44, we have a tobacco quit line, which opened in 1998, making Oregon the very first state in the country to offer to help tobacco users who want to quit. And since 1998, Oregon Tobacco Quit Line has helped close to 140,000 Oregonians quit tobacco. In 2004, Oregon became the first state in the nation to provide nicotine replacement therapy to Medicaid members who called the quit line. And today, Oregon is a national model for helping people who want to quit. Our model is built from the experience and the dedication of local governments and coordinated care organizations working together, the kind of work we're celebrating here today. So Central Oregon shows us what it looks like when health care, public health, and community organizations and consumers sit down together and create a common investment in a healthier outcome for their community. The investment Oregonians made 20 years ago in tobacco prevention supported this region to build a model for collaboration between public health and health care that now can be quickly translated into other health outcomes.